Good evening, everybody. I'm Dr. Rajani. I'm so excited to have everyone here today. We got an exciting show for you. I'm going to present and share tonight along with Amy Lynn, who you're going to meet. I learned a lot of things on the Asia tour recently. Something I learned I haven't even told Amy Lynn about, which is called priming. So we'll talk about that a little bit. But there's a paradigm shift that we'll talk about. And we'll also do a robust Q&A. And I know there's some things that probably a lot of you haven't heard about. Amy Lynn, who's been instrumental, absolutely, in helping me with this project and bringing all of her great industry knowledge and wisdom to the baby glow and beyond. So, Amy, thanks for joining us. I'll hand it over to you.
Well, thank you, because you were one of the big inspirations that made me want to actually reintroduce threads to my practice. And we'll get into that later as far as some of the practice gaps that I came into originally, and also with the people that I train across the nation and globally. So my number one is I'm the mother of 5 children. I call the Fab 5. I always like to throw that in. And so we actually started working on the protocol with the art of reversal, because what I like to do as far as training as a provider is see what's going on the market and then kind of figure out what a solution is to it. So we'll touch on that a little bit later. And again, Dr. Rajani, Dr. Keon Karimi were really impactful and supportive of that protocol, which led to us in the Baby Glow. So I'm really excited to be here tonight. I'm excited to share our origin story, because I don't think that has been talked about a lot so much. I mean, I've been presenting on this for the past few months, but I really want to talk about and dive into what your experience is as far as traveling in Asia, seeing what you're doing, common trends, and then how we're going to reintroduce this here in the US, which is really exciting.
I'll share that with you. And to preface it, what got me excited, Amy, was, I don't know, it might be a couple of years ago, I started talking to you about what I was seeing. And you were one of the first, your eyes just dilated and you were like, you kind of understood immediately what I was talking about. I think partly because of the art of reversal and a lot of the reversing you were doing. So we had that bond, and I appreciate that. And I know you're going to share some of that, but that's where all this came from. And so when I was traveling, what I get to do a lot, of course, I work with a lot of companies for skincare, also injectables in many clinics, particularly lately around Korea and other areas of Southeast Asia. But what I noticed was very interesting, because I would also get the staff of these big companies. If I'd be in the factories, we'd be having lunch, and there'd be 5 or 6 or 7 girls come over, we'll be talking, and I just was listening to what were they trying to look for beauty, and what could I learn? And at that time, it was still a lot of high cheeks, the Texas jawline, and the lip projections here in America. But what really took me by surprise was that when I was asking about beauty and what their I particularly wanted to know about their 8-step routines. And what I found was when they were looking at the faces and showing on each other what they wanted was subtleties. And that's something that you, Amy, deal with a lot and talk about when you're reversing, in the art of reversal, when you're reversing and bringing them back to subtleties after, quote unquote, deflating the face. And I think that's where some of this came from. But I'm going to share a part of the protocol we'll share with you today for what I saw that they wanted. But here's the key point. There's a shift across the country happening that I think practices can take advantage of. And the beautiful part of this shift is that it makes things so much easier for clinics, and the patient satisfaction goes up. And I think almost the patients are up here looking for it, and the clinics have to catch up at this point, where it was the other way around before. What do I mean by that? Well, what struck me was people wanted subtle, and they were happy with subtle. And Amy, you probably see sometimes they come in, and especially 5, 6, 7, 8 years ago, you might put a syringe of filler on each cheek and it looked gorgeous, it brought up, and they come back and say, I don't see anything. It's not enough. Like, what did I pay for? Whereas the direction we're going to is what struck me in Korea, particularly, they're coming in every month. They're doing 6 or 7 treatments at a time, and they come back the next month wanting more. And yet we're not jacking the faces up. And I'll go through some of the protocols in a minute, but it's more subtle. So rounder, fuller cheeks, kind of more on skin texture. I call it skin noise. So they call poreless skin, but I call skin noise like pore size, reds and browns, a subtle, more V-line chin, minimal nasolabial folds, shorter mid-face, and just brighter, cleaner eyes. And there's less stress and pressure on a clinic to produce these subtle results. So it ends up becoming a win-win. And Amy, you might comment, maybe you've seen some of this, or I know you've taken it and ran with it. And so you've got a lot of feedback from around the country, from the congresses. How do you find I'm biased because I've been in these Korean clinics where we're doing HIFU, we're doing monopolar RF, we're doing RF microneedling, and then we're doing Nepage injections and then microblading Korean sheet mask all in one sitting in 2.5 hours. And they come back every few months.
Yeah.
How have people received it in the lectures you've been doing? What do you find?
Oh, I agree with you completely. So before, I think the whole paradigm shift really happened where, as everyone was kind of being flooded with, they want instant results. They want to walk out. They want to look a certain way. Now they're more open to this natural rejuvenation. And since we have so many options and opportunity to provide that for them, they're now more open to it. I mean, I think back to like Sculptra, which I've always been a huge fan of, and it would take me sometimes a year, 2 years, 3 years to convince somebody to do something like that, or like PRF and even threads. And now they're coming in and they're seeking this out because whether they've had these other treatments in the past or are new to this, they want natural rejuvenation. So thank goodness my patients really like me. So they like seeing me a little bit more frequently. But a lot of my big approach is that you can do this in combination treatment. So there's a lot of options. You can do it all in one treatment and allow that rejuvenation to happen. Or you can also tailor it to the patient's needs and break it up in different treatment patterns that they're coming into. So I like that we have more options. And I think that the patients in the general market are very open to this, of that natural, beautiful, beautiful skin, like just giving back that youthful glow, that patients are more open to it compared to before, which is why they're also seeking out reversal agents and opportunities and kind of like filling in those practice gaps that we've had in the past.
Yeah, I think for clinics and I'm sure we have some business owners or combined business owners and providers, it really takes the pressure off a clinic. When people want to come in and they want to do more, okay, they're there, they can add. And I found what I learned in the past, especially 3 months, is that I should be more aggressive stacking. And I think over the years, I've been an aggressive stacker, but nowhere near what I've learned to do now. But also when patients come and they're like, hey, you know what? How often do you get someone come in, they go, I want to do all this stuff. And they get there and they go, oh, guess what? I'm going to the Christmas party tomorrow. I can't do this or that. But because you can tailor these treatments with minimal downtime and bruising, and you can shift gears from skin boosters, a little PRF, a little threads. Okay, you don't want, maybe you might get a bruise in the forehead with a thread. We're going to focus on the neck and the lower neck. You might be able to wear a turtleneck so you can easily maintain revenue, maintain patient satisfaction, and you don't lose that appointment because we're not jacking things up, so to speak, and creating dramatic results. So I wanted to appeal also to understand it takes the pressure off not only the injector, but the clinics are creating more revenue more easily.
Absolutely. And it's getting the patients back. You're also empowering your patients to also have an opportunity to be like kind of in the driver's seat, even though you're the one that is kind of giving that blueprint for best outcomes. But it gives them more of the opportunity to be involved. So it's not just so like, black and white. You're able to also tailor it to whatever their needs are, whatever their lifestyle is. And I think communication is key with this, and also just explaining to the patient, because that is some of the things that in the beginning, when I started playing with threads, I think that maybe the marketing wasn't tailored to the patient like directly in the way for expected outcomes and expectations. Whereas why like many providers moved away from it. And I think that just goes back to the foundation of when you are a provider or a business owner, just being very clear that this is going to be a progressive, beautiful approach, but they have to kind of like follow the process. And if they go for it, they're going to have great results.
I'm glad you brought up the threads because I to make it clear, I'll give you my stance on it. And I still like lifting threads. I like barb threads. I like molded threads. I think what happened, and I was just, we had the AMWC Bangkok was 3 weeks ago. So we had amazing lectures from around the globe of top thread injectors. And interestingly, in there, as you might expect, it was all focused on the lifting threads. But my opinion on that, and when we get into the Q&A, I'm interested to hear from everyone on the webinar, is just it became not everyone is suited for doing major lifting style threads and reverse vectors, and it gets complex. The beautiful thing is you can take it there if you want, and I still like basic barbed vectors and threads, and I think that we're going to see a comeback of that. I will tell you, in Asia, it's still not popular at this point, but I've always been a proponent of smooth, and I'll hand it over to you. I want to give one tip for people of what I think, and we have slides and histological studies on this for collagen production, but smooth threads, if used correctly, just subdermally, not deep in the fat layer, I think that's part of the key too, is the technique. Smooth threads give amazing results, and the baby was thrown out with the bathwater when barbed threads kind of got maybe a bad name, or maybe got too complex for a lot of injectors to use, or a lot of people just didn't like dealing with the side effect potential. And if you get one side effect out of 50, sometimes it's troubling because you can't just dissolve it with an injection. So my stance on it is I think smooth and twist threads just never got the attention they should have. And now coming back, I think we're focusing because it's all about collagen growth.
It is collagen growth and combination therapies. So throwing in some of the barb as well, I love as well. I just think the approach, because it was funny. I was talking to one of my nurses that have been with me for now 7 years, and we were training on the baby glow a few weeks ago. And she's like, do you remember day one when I was an intern? The first thing you had me do was use a smooth thread in an orange. So that was like day one. And then all of a sudden it just kind of got like swept away. And so that's why when we started talking about this again and reintroducing it, I'm like, I don't really know why I stopped using them, but like, I think now is the time because we know so much more, and we're in that, generation of really, collagenesis and building collagen and skin health, that it's a perfect time to reintroduce all of it in combination therapy approch.
Well, it's kind of like I've always been a proponent of them, but like when I'm sitting there in Korea and we're throwing threads in, and Buddy's just throwing all the threads. Buddy's a doctor, by the way, throwing in all the threads. And I'm like, he said, oh yeah, because we're doing a lot of foreheads. And obviously you can get a little bit of bruising and so what, right? But it's like, oh yeah, no occlusion, no lines, smooth baby forehead. Like he starts selling me and all the proponents of why they're doing so many smooth threads. And I'm thinking, yeah. But sometimes it takes that to plant the seed back, and you go back to practice, because you're right. Beginning injectors, it's one of the best. The only thing you have to watch for is being too superficial, so you don't see the color of the thread. So you rather, when you start, you err on the side of being deep. But it is something that I don't want to say beginning injectors can do, but early injectors can do because of the safety. Threads are just very smooth, and twist threads are very, very safe.
Yeah, and that was the first thing I trained her on, was smooth threads.
Yeah.
So with the baby glow evolution that's happening, she's like, oh my gosh, that was the first thing you actually showed me how to do.
So your beginner injector learned probably PRF right after that. She learned the baby glow 6 years ago, and we didn't even know what it was.
We didn't know it was going to be a thing. But I think also the placement and where you put it, which is why I love the kit part of it, because it simplifies the process. So I'm always about trying to simplify the process and all the reasons why people won't want to do it. So in the past, when we were opening up all the packages and you have somebody in your room where you don't have an MA, it's okay, grab this one. And once I get into my zone, I can go to town with these baby threads because I want the best outcome. So I'm let's discover an actual protocol that makes sense to give the best results and basically simplifies the whole process, so that whether you're a beginner or a novice or advanced, you can go ahead and you can actually just see what this structure and this foundation is and do it very simply. Then you can also customize it to whatever your patient's needs are. So again, I'm always about the more experience I get, I want less fussy. I know you agree with me on that. Less fussy, more organized, best outcomes. That's it.
And tell me, because we talked about the idea, you took it to the next level. And for people that don't know how much work that you put in this, and you said at the beginning you got 5 kids. I don't even know how that's possible. because you and I travel a fair bit too, and I know your kids are on the phone. So to all the moms out there, when you travel, this is one of the great procedures you can do when you travel, because you have peace of mind. I know when I travel, I try not to do barbed thread lifts if I'm going to travel and all those kinds of things, right? But on that end, but take us through, because you took this to the next level and created the kit. When you get the kits, you're going to get the full protocol, but take us a little bit through your mindset of developing the kit. And then what I'll do is I'll take people into the idea of the baby glow and kind of a little bit of the foundation of the end result that we're looking for. So, but tell me a little more about with the kit.
Of course. So with the kit, I'm a very visual injector. I'm visual in general. So I like to kind of like think about what this looks like underneath the skin, especially if you're just, injecting, subdermally like you focus on. So I'm thinking about like anchoring with the twists and also providing that skin nutrients with the smooth. So I started to think, okay, how many will it take to give it, to simplify it and not do, 300 smooth and twist threads on the face? For the average person, what is this going to look at? So I started to do some trials in office with the closest people around me and ones that maybe didn't have the best experience in the past with threads. So it's one of those things where I had to kind of like teach and also recondition some of the closest people to me that were kind of turned off by it. I'm like, they're going to give me the most honest and real feedback, because that's what I wanted. So I was thinking, okay, so how are we going to elevate, the brow? How are we going to add some support in the back? What are we actually trying to achieve? Then adding in the Easy Gel as well, which is something that, it's probably our number 2 producer in office. It's really so much regenerative now. How do we incorporate both of these modalities together to give it an even more of a wow factor? So the pattern was like really fun to develop. I felt like I was like Albert Einstein, like drawing on iPads, figuring it out, like drawing vectors and doing all these different things. My son will even attest to this, who like didn't know anything about this. And when I tried to explain it to him, he's like, I actually understand what you're saying. I'm like, okay, I got it. I think I know the pattern. And I've also like evolved with it as the more that I do it, to see how I can do this. So this was a great trial for kind of figuring out the best outcomes and also getting really honest feedback. Like I'm telling you, my people do not lie. And the before and after speak for themselves as well. And I noticed that my squad numbers here, when patients were coming in and they didn't see them for about 4 weeks or so, they're coming back for next treatment. They just kept saying like, oh my gosh, like, what have you done lately? And it wasn't like, oh my gosh, you had something done. It was like, wow, you look amazing. You look rejuvenated. And I started to notice those results about 4 weeks. So then I tracked it even longer, up to 8 weeks, and then figured out some people might need to do this in 2 doses and maintain after that. But again, we're also incorporating some of these other modalities and treatment methods to give the best outcome, including skincare and, whether it's RF microneedling or Sculptra or other regenerative approaches. But the overall result, like across the board, no one has been dissatisfied. And from prior, I've heard a lot of complaints about like the threads and the method and maybe the placement or just the technique overall. It's no one to blame here. Because again, I do love the barbed threads in certain areas, just not too aggressively, just for exactly, the lifting aspect in certain vectors. But this whole protocol, there's been no one that's been upset. So I can take that as like a positive feedback. So that's why the kit came about.
And that's awesome. And I think there's a couple factors that lead to that. Before I go into that, I'll for everyone listening out there, go to your back room, not now, wait till this is over. Go to your back room, find an old laser, an old YAG, or an old RF machine, fractionated RF, whatever it is, and combine it with this treatment. So a lot of people there were maybe devices you had in clinic that didn't quite give enough of a jack me up, like a CO2 laser, boom, you got all the downtime, and then the skin looks great or whatever at 6 to 8 weeks. But before, if you take a galvanic, maybe you had back there, maybe you had a fractionated RF, and people were expecting just off the charts result with one treatment, they weren't getting it. Go back and incorporate that device that you're not using, or a plasma RF device with this baby glow, and stack it. David S. asked a question, can you do the PRF and the threads in the same day? So just to give you an idea, in Korea, very, very, very typical treatment would be monopolar RF. Okay, I don't want to name all the brandings. You guys know monopolar RF, followed by HIFU, ultrasound. You know that. There's a couple now in the US. Followed by RF microneedling. Before that, they would have had cleansing and dermabrasion, and then follow it with a Korean sheet mask, some PRF thrown in, and some threads. Like that would be a normal treatment. And of course, you know, that we might do one ultrasound treatment and send people home, say, come back in 6 months, you'll get a facelift. We might do one monopolar RF and say, okay, that was $4,500. No, we're combining minimal, less aggressive treatments in a sense with this and getting better results over time. So you can reinvent your practice and you'll be excited about some of the things you weren't before. But I think a large part, Amy, of what's helped us with this is the fact that people were reversing products, that they're okay without that high cheek. And they realized you take a 25-year-old, you jack up the cheek, you bring the lips out, you give them the Texas jawline, and the 25-year-old, oh, they love it. But now they're going, or 30, and they're going, wow, I look 40 or 45. So it actually aged some people, and it made them look like they had more of a preauricular hollow, okay, like that. And that can be an aging feature. And they go, I want a little more rounded look. I want a little more baby fat. And we'll talk about PRF in a minute, but I think the foundation of PRF, of what we're doing, is, amongst many other things, we're helping the dermal thickness. We're giving glow. One of the things that came out of the lectures in Bangkok, which was interesting, because I work with a bunch of people from Pakistan, and you'll know they work with the most difficult melasma in the world with their skin type 4 and 5, and they're finding PRF and PRP, which there's studies on this, reversing melasma. A lot of people don't know that in this country, that PRF can be used for melasma and skin discoloration, what I call skin noise, all of it. But what we're doing is, I think at the very end of the day, making the fat pads healthy. The fat pads produce estrogen. Are you wearing red, some type of red lipstick, or like that's attractive, right? We add color to the lips to attract, right? So growth factor, stem cells, and a lot of people don't know, but we've now demonstrated exosomes, your own natural exosomes, in easy PRF with the spins. So maybe you want to talk about that a little bit, but you can see how excited I am because of where the market is. I love what you say. Patients are all ubiquitously happy, and we're able to see them more often. We need less new traffic to our clinics. But yeah, to answer his question, you can combine in the same day. Maybe you want to talk about some of the combinations that you like, or what your thoughts are on that.
For sure. And I think the biggest thing is saying this up front is that I always say you're going to see me the most in the first year. After that, our goal is to go to maintenance. And I think when patients hear that it's a process in the beginning, but then we're maintaining. So it's not like this huge super investment or investment of time and financials and everything like that. But the goal is to get you to that rejuvenated state. And then after that, we can kind of like gauge how many times you're going to see us after that. I think patients feel really comfortable and confident with that. Me personally, I will not fill with an HA in the under eye area, tear troughs, without doing something like PRF or easy gel. That's always been my method, because so many times when patients are coming in and they think they have hollowness, it's actually skin texture and quality improvement that they need first. So with the amount of reversals that I do, it's always incorporating using easy gel too, to provide nutrients to the skin, provide hydration, and improve that texture and tone. Many times they don't need HA. That's like my final approach after doing all the other things. And they're really happy. And I know for me personally, of removing all my lip filler and then rejuvenating it with, that's how the art of reversal was born, rejuvenating with my own easy gel. I mean, super, it was great results. I'm like, wow, okay, there's a need for this. And that's how you have to educate your patients to know that it's not just about filling. It's not just about providing volume in areas. Let's actually treat the root cause and make the skin quality improved, including things that are going to make collagen, elastin, and growth factors be a big part of it.
Excellent. Yeah, and this reminds me too, we now have the Kionula, which is nice 24 gauge, nice in between. And credit to Dr. Karimi, who isn't with us this evening, but he's been extremely supportive and a big part of bringing this to fruition for us as well. And so I think we'll have some fun, maybe lectures and webinars with the three of us together this year too. So we'll get him to pitch in too. But the Keonul is great because it's 24 gauge, right in between the 23, sometimes a little too big. Then you got the 25, which can be a little too narrow. But this chart here, I like because the development is what I'm doing. I want you to pay attention to a couple areas. Number one, the under eye. You see, it's a broad under eye brush stroke that we're doing. So it's the whole, making the under eye confluent with the lower lid margin. The temple, it's not the whole temple above the brow, jacking it up. Now you can use. I'm always surprised, and I have 3D imaging of using easy gel in the temples because I didn't think it would work so well. And it's held over 15 months on 3D imaging. So you can go up into the high temple, but it's just subtly at the canthal, at the lateral canthal crease, just adding a little bit of volume there. But particularly look at the cheeks. It's not the super high lateral cheek like we think with the Bella Hadid or the sharp. It's more a little in the anterior, basically the deep medial fat pad. Also slightly nasolabial pulls, but here it is in the jawline. I think this is telling. It's not the whole length of just a strong jawline from the masseter at the gonial angle anterior. It's actually softening it just above where we used to chisel it. And that's all to create kind of a shortened mid face. You see, it's all a centralized type of treatment. But that's what blew me away about the Southeast Asians and what they were doing, of what the girls were asking for. The men too, just like overall, they don't want anyone to really know what they're doing, but they want to have that pop. But it was very new to me that the females didn't want that high cheek. They wanted softer and subtler. So I like this diagram. It's part of the protocol, but obviously not the complete protocol that demonstrates exactly where and what to do that you get with the baby glow, right?
Well, I think also like as providers, they come in and patients are describing something and they're describing one way, but then when you actually position it to them, it's exactly what you said. They're not looking for this like dramatic, crazy things. I'm not that kind of injector. I like soft, subtle, yet significant improvement. And that's, the patients I think both of us really do attract. So when they come in and they're doing all these things and then you explain it to them, then it makes the most sense as far as like the landmarks with it. Okay, this is like the funny part because it's like not audio, but I'll walk it through. So this is my beautiful mom. She'll hate me that I put this video on, but I'm actually doing the Baby Glow Plus here. So I'm doing Sculptra, my 12-point tighter dilution technique, deep to bone first. So I always like to go deep to superficial. So if you are using Sculptra, I would encourage you to try that out first to go deep. And this is all in one session. So we did that first, and then now we're going to move on to, I think we're still doing some Sculptra. So when I'm doing the Sculptra like this at a tighter dilution, I'm looking for like those anchor points. So we're at temple, we're going in lateral cheek, mid face, piriform, right at the ramus, pre-gel and the piriform. And like I said, never inject this dilution if you're going superficial. After that, we went ahead and I hydrated the skin using her own Easy Gel. So you can see the area that Dr. Rajani just mentioned. I'm just making sure the skin is nice and hydrated. I went back and forth and we did collaborate on this a bit. And I said, I tried it both ways. I did threads first, then the Easy Gel. And I was like, it makes the most sense that we agreed on that we did Easy Gel first just to open up that area and then laid the threads on as far as like layering it as far as the approach. So I'm going ahead and I'm using the Easy Gel and I'm like basically just covering and smoothing the areas that I'm going to put the threads in. So it's a great prep for the threads as well. So because it opens up that space. I know a lot with the barbs, like we go ahead and we use a lot of lidocaine and everything like that. So this is an option that we're able to just go ahead and smooth the areas that we're going to address as far as the threads are concerned. And we'll get into the next part as far as like the reasoning, as far as what kind of threads I use in each specific area, including like the threads are the twists and also the smooths. So I am now pinching the skin. So I'm a really active toucher of my patients. If you couldn't tell, I like to dance around. I like to pinch, I like to smooth. In this case, we are using the blunts. And so I wasn't sure about the blunt threads. Honestly, I always was more about the sharps because I didn't realize how many threads I could actually put through like one entry port with that because they're so fine and they're so baby and they're so teeny. But I was impressed at how many I was able to thread through that one little entry port using the blunt, entry with this, and pretty good. But either way works good. I like both ways. I think you can't go wrong. It's whatever your comfort level is and whatever you like. I do. It's also, I think you'll agree with this too, Dr. Rajani. It's the condition of the skin to see. So my mom's like she's almost 70 actually. And she's been doing things like biostimulators. She has had a facelift in the past. So making sure that you're really like touching the skin, seeing what the quality is will kind of guide you as far as like whether you want to use the sharp or also the blunt. And again, I love both. Blunt, you might get less downtime, but sometimes it's a little tough to pass through in certain areas. These are the twists. The reason why I chose twists for the nasolabial folds is to add that anchoring and that elevation. And if you think about how the twists work, once it's injecting, it's almost like a corkscrew, like a wine opener. And so when the collagen is developing and the thread is being reabsorbed, it's giving more of that like holding support compared to what the smooth are as far as like the scaffolding and beautiful matrix that it's developing under the skin.
That's awesome. Yeah. And I love we're going to go into some before and afters, but before we did, Sarah asked a question about, the jowl and the jawline and putting a little above in terms of lift. What I'll tell you is you get more lift along the jawline because now you're able to afford a little more rounded look as opposed to a sharp border, which if you get too sharp here and you don't address the melomental fold, yeah, you might have a sharp jawline, but then you have a downturned mouth, and that's incongruent with an overall baby face. And if you add a little higher, okay, you get a little more volumetric lift along the jawline, and what you're going to find is it looks natural. I'm glad you showed that the twist going into the nasolabial fold because traditionally people would be like, you could put 4 vials, and if you, I'll date myself because particularly 2003, Restylane was introduced thereon after. A lot of the approval trials for fillers, we did them in the nasolabial fold because that was the standard. You do 4 and 5 vials for nasolabial folds before people would see a difference. So 4 or 5 mLs of filler, that's a lot. But now you can add twist threads. Yeah, you're not going to jack the nasolabial fold straight up so you're simian, so you have nothing there. But when you do the full face like what you did, you're getting pulling vectors from different areas, you're getting increased collagen, you're getting skin tightening, and they will notice it. And like you said, they're not going to, they hug you right away. They're not going to hug me right away. It's at 4 months, it's at 8 months, it's at 12 weeks. And you'll start to see it by about 4, 5, 6 weeks. So you hold them through. But you mentioned something important before Sculptra. Sculptra came 2004. Aesthetically, it was approved in 2009. But to be a great Sculptra injector back then, half of it was entrusting the process and being able to look your patient in the eye and say, okay, you might not love me in a week from now, but at 6 weeks, you're going to start to see it, and you'll really see it at 4 to 6 months after a few sessions. Now, I think people are more comfortable because they have the history of my era of seeing the changes. They actually do happen. The same thing is with what you're talking about, with adding PRF and threads and combinations. Newer people coming into the field, you can entrust the process that they will see it. So it's part of the patient's acceptance of less dramatic, and it's also the injector trusting the process that it will happen and that confidence. But you've done a lot of the work to give the people the confidence, and so thank you.
No, yeah. And I think patient identification and again, communication up front and not over promising, but understanding that this is a process, but once they sign up for it, they're patients for life. I mean, we're part of the journey. I'm not a provider that just wants a one and done kind of thing. I want to be part of their journey, part of their aesthetic journey, and also build that trust up front. So I think transparency is absolutely key, like in any relationship, right? And I think that that's really important up front in educating your patients and understanding the process and the science that we got into tonight and how you can apply that to what things that you're already doing. I mean, this was like an easy kind of like transition into something that, again, this isn't like new. It's hot on trend right now. It's something that kind of was swept to the side for a bit. And now we're bringing it back in a simpler way that's more well defined. And the results have been amazing.
I had a question. How do you frame it to patients? And I would say part of it, you see, if you injected biostimulators for a living, it's very easy because you see it over time. But you frame it to patients like, look, and it's where facelifts have gone too. It's where pulling more vertically, not laterally, horizontally, not making people look new, but making the best version of themselves. And you just let people know that you have their best interest over time to make subtle changes, but also having confidence that you are going to make it right, meaning you set the expectations properly, but you have built-in revenue here. This is how I'm telling you how I perceive it. And then you can I have a couple other questions that were asked, but how I perceive it is, look, some people are going to be happy with one. If they have enough built into their package or they have 2 or 3 or 4 sessions, they're happy with one. Okay, great. Don't come back at 3 months, come back at 6 months. You have something in your account. Some people need 2. Okay, great. Let's say they purchase 2. If someone needs a little touch up and they come back with I'm happy with things, but this didn't fill in as much, or I'm happy with things, I still have some smile lines. I just throw it in an ad because there's a built-in revenue. It's not a $400 vial of filler that we have to go grab out and use out of the closet. You can grab 4 or 5 threads off and make people happy. People just want that. If you take your practice and you think about this is what I've done over time, is I go, what does Rajani want if I come in? Throw me a bone. Meaning, I come in, I bought easy gel, 2 sessions of easy gel, and I come in, I go, you know what? I'm kind of happy with everything, but my under eyes really bother me. I grab some more and I throw it in there. And then that's your patient for life. I don't lose it. Oh, it was $150 in my pocket and part of my time. That builds your practice. They're not going anywhere else. And it's $1,200 to obtain a new patient. I want to keep the ones I have. So don't be stingy with adding a little more. I'm just sharing my mindset. That was the question. How do you frame it? And I know you have some before and afters, and maybe you can go into a couple and answer this question. But the question was, who is somewhat like the best, most appropriate patient for this?
I love this question. Okay. So I do a lot of mentoring here in house, and some of my young 20s, like they're, 21, 22, and they're like, am I a candidate for babyface? And I'm like, you are actually. So it's kind of cool. And before we did the last webinar, I had I call them my littles, but like they're like, I feel like they're more mature than I am in a lot of ways. But anyways, they asked me and I was like, that's an excellent question, because if we're like encouraging collagen banking and kind of like that proactive aging approach and like introducing Sculptra or easy gel like in our mid 20s or early 20s to kind of set you up for success, and we've talked a lot about this, there really isn't anybody that's not a great candidate. Again, if you are approaching and have never had any sort of surgical interventions and you're in your 50s, 60s, it's realistic expectations. So how much can we get you to the place that you are like happy? I don't think saying that this is a facelift is fair. It's absolutely not. That's surgical and this is like non-surgical. So it really is all patient dependent. I think lifestyle also plays into it. But I've done some of my mid 20s and they are so happy. They're actually seeking this out because they're thinking collagen banking. They're thinking, okay, this is going to set me up for success. So then later on, they don't have to do so much. And so really, I mean, I see 20s all the way up to I've done it in their 70s as well. They're really happy. But again, it's about lifestyle. It's also about what other modalities and treatments they've had in the past. You can't set it up and be like, okay, this is going to be the one and done type of thing. Like you'd mentioned, it's multimodality. So I think it's variable depending on the patient.
Yeah, it's good. And for our audience, just to let you know, like one of the things too that blew my mind a couple of years ago, I was working in Korea with some biostimulator companies, and I said, just let's interview 10 Korean girls about their step routines. And what blew my mind is their Saturdays, and they're age 25 to 35. Their Saturdays, oh, that's my skincare day from 9 to 5. I was like, what does that mean? Well, at home, they do their routine throughout the day. And sometimes it would be a 3-hour mask. So they do other things. But their Saturday, before they went out for their Saturday night outing to have fun, was all about their skincare routine. What am I getting at? Is understand 20 years ago when a patient would come into me, they'd be like, oh, Rajani, I'm putting in a brand new kitchen. I got my purse. I got my nice car outside, and I want my $450 vial of filler. And that's when fillers were like $550 to $600. And I'd be like, okay, so you got a kitchen, you got a car, and you got new hubcaps and wheels. Great. New tires. Perfect. But you got like $400 in your face.
Right.
The new generation is total opposite. Interest rates are up, inflation 6%, real inflation. They don't want a home. They don't care. They want to travel, and they want to spend it on their skin, their looks, and collagen banking. And they don't necessarily want to look like their mom unless their mom is you. That's you're the you know what I mean? But that's what they used to say. I don't want to look, but now moms look different. But that's what they would say back then. So the point is, the skincare now, they're targeting under 15-year-olds, right? Like that's a whole other level. But I'm telling you what's coming through on SEO because they know that's the low-hanging fruit. These girls are particularly girls. I mean, I'm shocked about the young boys too. I got to tell you, coaching hockey and stuff like that. These kids, they're looking at their face and their phone. It's not just girls anymore, probably, right? I have to include guys because I never looked at like that. Like these 15-year-old boys do. They're looking at their style way more than I remember. But the point is, they've grown up with their moms going in for Botox and fillers. Like it's second nature. So we have to understand the market. 25s to 35 is probably the number one driver into clinics. The 50-year-old plus, they get angry at that. They didn't need it. You don't need aesthetics. You want it. You desire it. It's part of their lifestyle.
Exactly. I see that with my own kids. I mean,
You do.
God, I mean, I'm like, you guys have everything at your fingertips. And let me just tell you, they take full advantage of it, which I love. I mean, when I have my boys coming in and getting like different treatments and this and that, I'm like, this wasn't a thing whatsoever. I didn't know anything about skin care back then.
Yeah.
And so I look at the lineup. The only thing I get annoyed with is when they take mine and like they don't replace it, even though they have their own. But they are really into it and they're looking at things like on TikTok and Instagram and watching these influencers and really following it. And they really are into skin health. Whereas, back in the day, we weren't even wearing SPF. I mean, that was
Korean sheet masks in Korea with little teddy bears and stuff on them. You know what I mean? For the kids that were wearing them. And to me, that's hard for me to get my head around. That's a little young for me to be like, but just to let you know, when I'm doing social media and putting in tags and everything, what's coming up suggested for me is under 15, under 14 skincare. Retinol is like aggressive, so which is a little much, but just understanding our market, and that's where Babyface fits in. So I agree on that. There was some. Do you want to show a couple before and afters? Because that might explain to people. And then I don't see my chat window open. Maybe they'll open up the chat window and I'll answer more questions. But let's look at a couple before and afters because I think that you can go through a couple. That would be telling.
let's go back to
Because they're going to be a little older than people think. I mean, we're talking 25 to 35, but for me, it's a lot of 50, 45, 50, which people might not understand that, but go for it.
So this is a patient known to me for about 10 years or so. She went into like more of that puffy era for a while. We actually backed off of any HA fillers and, she had Sculptra. She did the whole thing. Some lifestyle changes. I think her cortisol was up, but I convinced her she's also a very frequent patient that comes to us and I adore her. So in the beginning, after a period of time, she started seeing one of my other providers and I took a look at her. I'm like, what's good? She's like, I flagged her from getting a lot of these treatments. We kind of moved into this other stuff. I'm like, there's something going on underneath because I knew what her history was as far as getting multiple fillers in the past and everything else. So what I did was art of reversal pretty much everywhere on her. And for her, aesthetics is a big deal. For her, she's a multiple gym owner. She's a fitness model. She's out there in the public. So kind of convincing her to reverse most of the things that I did years past, What wasn't actually that hard because she trusts me. So we did the art of reversal. And then what I did was the baby glow. And you can see at 4 weeks, she just looks more feminine. She looks more soft. She looks more awake. I always look at a patient's eyes because eyes are the windows to the soul. And I just think overall, her rejuvenation is just really subtle yet significant. But I think it gave her back that like feminine type of like soft baby face compared to what was going on. And that can happen when you have a buildup of fillers, like, over time and attracting that water into the HA. But this, I think, was a good result. And also, I love her brow lift in this picture. But her under eye rejuvenation, overall facial structure, when you're looking at somebody Pam facially, I think she looks overall really natural and good. And that was only.
I think for people looking, I mean, look at the transition of the lower lid to the deep medial fat pad cheek. And I think your point, one of the points that you could potentially miss if you didn't really look for it is if you do a flash test and just go, which one would I be more attracted to, or which one, you use the word feminine. I agree with you, but look at the under eye transition and just, even though you've taken a little fullness out from the fillers, that heaviness kind of right down here that adds a masculine look is gone, right? So it's kind of that flash test that's the subtlety of it, right?
Yeah, but it was just enough. And she was so happy. And now we're about like 8 to 10 weeks out. So I'll be able to share them on social soon that she looks even better now. So that's only 4 weeks, which is pretty good. And she's so happy. And that's the big thing. And like her lateral canthus, like how it's like tilted up and everything is being drawn back up to the foundation. I think it's really good. So only at 4 weeks, it was a really good result.
Let's see if there's another one. If they can pop up another one first, because I know you. Okay, grab. I like this one too, because it's not a 20-year-old, right?
My mom.
Yeah,
Your biggest fan.
I love her. I'll send her some stuff. I love your mom. She is my biggest advocate too.
Your number one fan.
But look, I mean, you go through it, but look at the smile lines, right? The reduction. Just take the smile lines, for instance. That's a very difficult thing to treat in through here, right? Like, and you don't want to bulk it up. I think that's part of it is you don't want to bulk the area up with filler, HA filler, or even superficial filler. I don't know what you did, but I'd be looking at threads and PRF, but what did you put right in there? I know we saw the video. It looked like a little easy gel, right?
We did easy gel. I did Sculptra deep and also the combination of smooth and twist. Now, my mom did have a facelift about 2.5 years ago because I actually flagged her because I said, what you want is actually nothing I can give you. Like, you need to go and get surgery if that's.
I like that. You flagged her.
I did because I'm very honest with my patients because I'm a really like honest injector and person that like, even my own mom, like, I'm not going to keep chasing this. Like, you're approaching 70, you're beautiful, but I understand what you want to have done. And that's nothing I can achieve, whether it's just regenerative or fillers, but I'm not going to do it anymore. So we had actually built her skin up pretty good with Sculptra and PRF in the past. She did have threads a long time ago or so. But the plastic surgeon that actually did her facelift said that because of the placement of all this regenerative approaches, Sculptra, Easy Gel, it made her facelift a lot easier, which is really good to hear because I know there was controversy with that. And really what the goal here was to really kind of smooth out those fine lines and wrinkles in that like pre-buccal space and also just give her a little added support. And again, this is 4 weeks post and she looks even better now.
Of course. 4 weeks is baby early.
So this is one of my practice managers, Jody. We also did the art of reversal on her and like probably about 1.5 years ago. But you can see like at 4 weeks, you can see like her oral commissure is more lifted and elevated. Her under eyes just looks brightened. And I don't touch up any of my before and afters, just so we all know, like this is just like raw. I try to get the best lighting that I can to be consistent. But I think her under eyes, just from reducing her filler prior and also building it back up with Easy Gel and then doing the whole baby glow protocol, like her brow looks big. She just looks more awake. She looks more soft. And I think that's what people are actually looking for. They're okay with not looking like an avatar anymore because that was an era. But now they just want to look soft and like approachable and just like their own natural beauty. And I think that we were able to achieve that pretty well. But I love how it turned out, especially in her oral commissure, to kind of pull that and support that back up.
Beautiful.
And then here's another one of your fans, Cheryl. So she's had a bunch of things done in the past, but I did the baby glow, and she was really adamant about not getting threads again because she didn't have the best experience during her training that was done. I wasn't the one doing the threads. I was kind of the observer of the day, and she was actually kind of scared. I was like, just trust me on the process. So we went ahead. We did do some sculpture with this. Again, this is 4 weeks post. It just keeps getting better and better. And we did the whole protocol as far as like the twist combination and also the smooth. And you can see like she just looks brighter. She looks more refreshed. She's in her mid 50s, believe it or not. And she's super happy. She was like my biggest poster girl with this because when she would make rounds throughout the day and go to the front desk, all my patients were asking her, like, what did you have done? You just look like you're glowing. You're happy. You look rested. And yeah, so that was the baby.
And I will tell people here, like, it's more of a real life thing. Like, you look better in real life, and the camera is going to be difficult to pick up the subtleties that it does. And that's the tricky part of this. I use 3D imaging. I like 3D imaging. That helps a lot because it picks up subtle volume. It picks up subtleties. So people who, I really think 3D imaging is kind of the standard. We're in 2025, pretty much 26 now. I mean, it's great to have the ability to do that. Overall, we'll all move towards that. But I'll tell you, in Korea, the consult rooms are very important. It all happens in that consult room. So the consult is still key. If you can do a good consult, you win.
And work together with you and Dr. Kian Karimi and kind of like work together with how we can make this a little bit easier and streamlined for patients who might be really hesitant as far as reversing it. Going back, I always say it's like you turn into like a cluster of grapes as far as the filler, and then you turn into a raisin. And then how do we make it a solid grape again? And this has been a really great hybrid as far as rejuvenate using the Easy Gel. So developing even like the baby glow, I was like, well, Easy Gel I use all the time. So I already love this. How do we combine that with the threads and kind of reintroduce this together for a proper protocol to make it easier for people? I'm so excited because next year I know we're doing a lot of collaborations and trainings together throughout the country. But there's going to be a lot of additional support also as far as trainings are concerned. So you don't have to feel like you're like just buying these kits and you're not supported. Like anyone who gets the kit will also get the protocol and additional trainings as well.
Here's a question that's interesting. I think in the event that clients already have threads from elsewhere, so maybe an unknown clinic, okay, great. What should we know protocol wise for PRP and Easy Gel? Understood, in brackets, understood that Easy Gel is preferred to be done first. The main reason that you're doing it first in the main session is the threads are just placed. So after a couple weeks, the threads are kind of where they're going to be. But we determined that doing the gel or the PR first allows you to obtain the plane for your threads more easily and disrupt them less. So if someone come in from somewhere else, don't worry. Threads. So what you're going to find around the world, PDO, which I still think is the best, and that's what Nova threads are, PDO threads. But understand you'll get PCL, polycaprolactone. Those are going to last you about 12 to 18 months. Or PLLA, which are about 9 to 12 to 13 months. So those are different types of threads. So when you say came from somewhere else, it's always good to know what's in the face and understand that you want to have your patients and try and keep them with you so you know what's in their face, obviously. You can't always do that. But threads are one that you have to worry about least. What do you worry about most? Things that are permanent in there, like PMMA, which is Bellafill, which no problem. I like it, but just be mindful. You don't want to seed that with bacteria or silicone. So if you have more permanent products, you don't want to get a biofilm. That's when you want to be really worried when they come from somewhere else. But in terms of doing threads, have at it after a couple of weeks in terms of layering, and just understand you're probably not stacking enough versus, overstacking. We all think we're overstacking procedures here, but you're not. Are you? And you can take this one. Are you concerned at all about overproduction of collagen with the combination?
Not really at all. I'm not. Are you at all?
I'll take the overproduction.
So overproduction would
If you can overproduce me, I'll pay you double.
Yes, I know. No, yes, exactly. I'm like all about that. Let's overproduce it. Let's go. No, especially because you're using your own body's mechanism. I mean, especially with Easy Gel, like I don't think you could overproduce too much that is already a part of you. I think it's going to be just enough. And also with the threads, I'm not really too concerned with that whatsoever. But if you want to overproduce collagen, I'm all in.
And to clarify, Jordan's talking about with small nodules from the threads. I think a couple things on that. If you're putting, I'm comfortable putting about 4 to 5 threads, smooth or twist, through a single opening because you're coming back to the same point all the time. Theoretically, you could get the nodule. We don't see that with 4 or 5. Amy, you can comment on how many you do, but the nodules from smooth and twist are extremely rare. I would say the only other thing you want to be mindful of is if you're doing smooth, especially longer ones, you're coming through very hyperdynamic areas like a melomental fold down into the mentalis. There, theoretically, they could bunch up, but honestly, PDO become pretty soft in the body by about 2 to 3 weeks. So I personally knock everywhere, never had a nodule with smooth or twist myself. You can comment and you train a lot of people. So maybe you've seen anything?
No, I have not with smooth and twists on the.
Yeah.
I never want to say never, but no, up until this point, I have not. And I think that as long as you're in the right plane and you are really intentional with the actual placement, I have not seen any of that yet. For like, not to say that it can't happen, but I have not had any problems with that.
Sarah's talking. I can see clients' faces jerk when I do their permanent makeup. I think jerk may be misspelled. I don't know. But here's the question. And I see the trail from the thread. Can you explain what's happening? So you don't want to be intradermal, which is hard to get. You want to be just subdermal. Now you could theoretically be going up and through the dermis. So if it's too superficial, you might see it. Here's the other time you see it. There's 2 other times. One is you put the thread in and then you get a bruise or a little bleeder in between, and the blood goes along the tract of where you created the opening. So you have a tract of fresher blood. But here's a third one. So let's say you put a smooth thread in and you get that tract of blood. You could theoretically get a little hemosiderin staining, which is staining under the skin from the iron of your blood. But that will go. So I've actually never had one like that. I've had it where you can see it because there's fresh blood, and that can last up to a week or two. And if you get that, that's gone in a week or two. It can scare you at first because you do see it. So depending, Sarah, how long after, it could be hemosiderin staining. Certain threads, and this is the problem, one of the most popular procedures in Korea, Southeast Asia, from 1 year ago to 3 years ago, so from 12 to 36 months ago, was injectable liquid PCL, polycaprolactone. The problem was you could start to see blue come through the skin, like Sculptra's colorless, PRP is colorless. When I went back this time, we were barely using that because of the complications from it. So my point is, if you don't have the right threads, theoretically, they could be overly colored. You could see the thread through, but if you're using good threads, and I've never seen that with Nova threads.
Me either. And correct me if I'm wrong, but from my understanding that the smooth and the twist Nova threads are the only FDA approved threads in the country, correct?
Yeah, I mean, there's FDA approved, FDA cleared, made in the USA, packaged in the USA. But yes, as far as I know, but I can't. I've used Nova threads. I've used many different threads in Asia. I use different threads. What I can say is, when you put something in, it's not permanent because the nodule question and the overproduction of collagen leads itself to the question of PMMA, which I like, which is Bellafill. You could say with Sculptra, if they last too long in the body, you could get nodules from overproduction of collagen as opposed to granuloma or just clumping of the product, which is a nodule. However, with a thread, it's going to produce the collagen for PDO. Remember I mentioned PDO is probably the sweet spot because PCL is longer lasting. You're more likely to get a lump or bump because it really hits this sweet spot for producing collagen from about 1 to 3 months and then tapers. And that's what makes the baby glow safe.
Yeah. That's what I love about it too. Sometimes people think like longer lasting is better, but again, back to even like the art of reversal and some of these fillers lasting much longer than we ever expected. sometimes people are like, yes, sign me up. But like, as we're aging too, we have to also understand and identify the underlying causes of that. So if that filler or any of these other modalities are staying there, but your body is still aging, it's not going to be able to give you that result because everything around it is not being fixed. So that's why like Easy Gel, Threads, Sculptra, any of these type of things, they're kind of like correcting the underlying causes of aging and not like committing to the fact that, you know, an HA or any of these other things are going to be there. And then the surrounding areas and the foundation is still aging. So I think that's what leaves us with less desirable results.
Sarah that said, yeah, the type of thread seems to be important, and that's true. Let me just touch on PRF real quick because this is an important point. The type of PRF matters too. Remember I said we've demonstrated exosomes in the aliquot. We've demonstrated growth factors. One of the interesting forward-looking kind of areas of science that I'm interested in is different spins giving different types of growth factors, depending on what we want. So maybe we want more vascular endothelial growth factor. Maybe you want more fibroblast, depending if you want the under eye, or you may want more fibroblast growth factor for somewhere that needs more fill. But that's down the road. But understand, and what gives the whole industry a bad name is fake. And whether it's skincare, there's fake skincare all over the place. You can't tell the difference from the packaging. There's been fake fillers. We dealt with fake fillers. The threads aren't fake. You can just get poor quality. But with PRF, I call it fake PRF because people take a given spinner and a tube from their lab or wherever, and they believe that you can just take any tube and any spinner, but the angle of the spinner, the speed, the fact that the tube is coated with a special coating so it doesn't prematurely clot, the fact that you take the blood out and you spin it right away so it doesn't have microclots in it, that allows the exosomes and growth factors to get to the top. There's many factors, but some people come in and they'll say, hey, I had PRF, but did nothing. Oh yeah, what did you have done? I don't know. There was a spinner. You have to have, and I'm not saying there's only one system in the world for PRF, but what I am saying is you need to use a studied system that the spin and the tube match to produce the proper aliquot in a high percentage of time. We're all going to have different blood with viscosity. There's going to be some variability. Some people are on hormones. Some have high lipids, different things. But understand there is fake PRF in the fact of just because it didn't work and they had it spun somewhere else doesn't mean yours won't work. I think that's an important point. I like people to
100%. Because I know when I first opened 9 years ago, PRP was the hot thing before PRF was, was a thing. And results were inconsistent because we didn't really know a lot about the spin factor or like what even like centrifuge. I remember my first one was like a dinosaur. It literally was like this big. It weighed like 2,000 pounds. It was clunky. It was not mobile whatsoever. And, but now we know so much more. And that's why with the PRF, I think this system is absolutely key. I agree with you 100%. It's more consistent. And again, like the more like evidence and also, experience we get, we want things that are going to be consistent and less fussy. I always use that word, but it's true. We don't want to inconvenience patients. We don't want to have to go through that whole process of explaining why. So I think also preparation for the patient prior to and using a spin cycle and an actual device like a centrifuge that is consistent to deliver great results is really key.
Yeah, and Sarah's commenting on PRP too. Understand, PRP is easy to make. You just take the blood and you spin it super quick because a lot of it's just albumin. There's not a lot in there, in my opinion. There's not a lot of growth factor stem cells. Some of it's good and some spins are good. But a lot of people, when you spin something quick, you're going to get rid of the red cells, which is what you want, and that's great. But you're also, the lightest product in there is what you want. The lightest are your exosomes, your growth factors, and your stem cells. When you spin it fast, and for a long period of time, like 4,500 RPM, like PRP, for 10 to 20 minutes, sure, it's going to look crystal clear, beautiful, golden, but it's golden nothing. So PRP, back in the day, it was easy to make too, whereas PRP is more finicky in particular, but it's worth the time to get it right.
Oh, 100%. And it's a very quick, if you're just using straight PRF, it's 5 minutes. It's like in, out, you can add it on to other treatments. I combine it with so many like different treatments as well. It's just like an easy add-on. So it's not like a ton of time, which is great too.
Yeah. So some people ask about system comparison. It's really hard to design a trial to look and compare different systems and different spins. It's expensive. And at the very end of the day, the bottom line is company. So no company really has $3 million to spend on that. But I would say is that you can go from science, because we're talking PRP and people's different systems. Um, I would say the science showing when you take real PRF with exosomes, growth factor stem cells with the amounts that they're in, and you form a fibrin clot, what we factually know is that it slowly drips in growth factors over time. And what's Amy talking about with the baby face is slowly building your collagen over time. That's with the threads, slowly building collagen. The Sculptra that she did, slowly building collagen, and the PRF. So it's about releasing things slowly over time and giving better results. But in practice, in my clinical practice, clearly, I was able to do half face with PRF and PRP when it first came out. PRF blew it away. Dr. Creamy's doing a great trial. He did nasolabial pulls. He's now doing the under eyes, and I know there's preliminary data. But I got rid of my PRP personally, and I had 4 different systems. I think 2017, 18, somewhere in there.
Yeah. Me too. I had a couple systems, and again, they took up a lot of space and a lot of time and took so much more. And so this is so easy to just like move around the rooms. We have a whole station here for that, and it's a lot quicker. And I think that the studies that are coming out like will really prove to support all of that.
Question: can you add exosomes to PRP to enhance the preparation? My take on that is most people come in, they want autologous. And so you have your own exosomes in there. Those are the best. I'm more and more brought over to exosomes, and I understand it. And you could, theoretically you could. The most people that want the procedures, and now they if they're doing PRP, there's a reason that they want it. There's no studies done. People like to make a bunch of stuff up, but there's no studies done that include PRP and exosomes. So you're welcome to try it unto your own. But keep in mind too, a lot of exosome products actually don't have active exosomes. There's a few companies that have them. But if you're using good exosomes and you like them, for me, that it would be a separate treatment. In Asia, of course, we're injecting exosomes all day into the face, either exosomes or salmon sperm facials, not both at the same time. So you're either getting exosomes injected over there or PDRN, and you stagger them, not same day.
Yeah, exactly. I think that patients that are seeking out treatments like easy gel PRF or just straight PRF, like they're seeking that for a reason, and they really don't like want a lot of additives to it. Like it's just kind of a standalone, or you're incorporating things like threads as well, but they're not actually requesting to add anything else to me, at least in my experience.
Let me answer a question from one of the most amazing injectors in the world too, just like you. Olivia is asking, you can answer this because I know her, so she'll know my answer. So here's her question. You ready?
Yep.
Do you generally like using Sculptra same day with the Easy Gel /PRP /threads? So do you generally like using Sculptra same day with those? And of course, as she's saying, every patient's a little bit different, but you showed the patient at the beginning that had all of that, your mom, obviously at the same time, but comment, because I think a lot of injectors are scared to stagger. You give your answer, and if I have anything more to add, I will, but you answer, Olivia.
My favorite treatment these days are doing a tighter dilution deep to bone, 12-point injection technique, starting with Sculptra, then going ahead and hydrating the skin in areas that I'm going to be putting the baby collagen threads as well with the Easy Gel, and then going ahead and stacking the threads in a very intentional space. I love doing all 3 in one. That's my favorite. Now, if a patient comes in and maybe they've already started their Sculptra journey and they are like kind of halfway through and they're like, okay, well, now I want to do Easy Gel and the threads, you can absolutely do it that way as well. My favorite like trifecta is the 3 together in one shot. And it takes, honestly, once you get it down, the longest part is preparing the Easy Gel. But if you have support and kind of time it the right way, you're able to also do that. We've gotten it down to about 45 minutes total for all 3. And that includes also the preparation of the plasma and everything involved.
I think once you get into the role of doing it, of making it, I think it's interesting because I'll go into a clinic, we'll do a training, and they get really excited about things we did 4 years ago, just because they got off the roll of doing it, right? And once it's like if you haven't made Easy Gel for 3 months or whatever, because of whatever reason, and then you're like, you have a block in your head about doing it, then you start doing oh my God, this is fun. And so it is a lot of fun to make it because it's used to be where it would clot. You have the problem, you got to redraw the blood, but that's pretty rare now. And one important point I want to make, and Sarah's kind of asking a little bit about microneedling PDRN. Do you think it's too basic? Microneedling, a lot of it's done through the channels, and why not do PRF? And here's the one thing. I like PDRN, I like microneedling, but here's the thing. To do a blood draw, let's just be honest about it, is once you know where your supplies are, let's take that wild card out of it. Once you're doing it, you go, here's my supplies. You bring it to the table, just like anything else. It's what, 2, 3, 4 minutes to draw blood, because you want to get, the longer you wait from the blood to get to the spinner, the more microclots you have in the blood, and the more the growth factor stem cells don't get to the top. So we know you want that time to be quick. You draw the blood, immediately get it to the spinner. That's the key. But it's a 5-minute spin for your liquid. So a 5-minute spin gets you all natural versus taking something out of the package, like particularly now what's hot is single growth factor products. Okay. So I won't name one, but if you just think PDGF, BEGF, someone hands you a single growth factor, it makes absolutely no sense to use one growth factor when we've demonstrated over 6 in our spin anyway. But we know there's 30 growth factors. There's way more than 30 growth factors in your body, in your blood. Why not have them all? Like, why pick one, and why pick 300,000, 200,000, 1 billion? Where does that number even come from? So my point is, go for all natural. A blood draw is no big deal. And women are so used to getting their blood draw, right?
Why are we so used to getting our blood draw?
Because you guys actually go to your checkups and your appointments. Doctor calls me up. I don't even pick up the phone. I'm like, doctor who? But, like, we're scared to go. I'm scared to step foot. And most men are like me. They're like, you're not, like, leave me alone. When I drop dead, I drop dead. That's how it goes. But you guys are so used to going to appointments. You take it seriously. You're used to going to the doctor for things. And you don't pass out. You're tough. I mean, that's the bottom line. Women are tough.
There we go.
Yeah. Men are babies.
This is like,
that's what it is.
Yeah. Baby glow. One thing also, this is totally like a little bit off subject, but I always think about efficiency as far as like timing this, and how do you basically entertain the patient that's sitting there waiting for this and kind of waiting for the whole process, because it does move very quickly once you are all set up and you have everything prepared. We also recommend like things like adding on an IV drip when they're sitting there, or doing like a different facial service. So it's a nice opportunity when you have that 30, 35 minutes or so to give them something like that, or offer that to them. So you can add on it so you don't feel like your patients are like sitting around for 35 minutes or so preparing that as you're getting set up, because once the process kicks in, it's very, very quick. So it's just another like opportunity that you can share that with your patients so they can, achieve the benefits.
Most of the clinics I was in Korea particularly had hyperbaric oxygen, and I put that on video. It's on my channel. I put a video up on it. But what was interesting to me is they're 4-seater hyperbarics, and there's 2 of them side by side in one clinic. So I'd be in there with you and someone else who's getting their treatment. And another note to everyone, and I got videos of this. I went into some clinics. There was 4 clinics side by side, and then another 4 side by side, door to door to door, offering the same treatments, right? So they don't worry about competition. The other thing is the rooms were as big as a shoe. You couldn't even get the tray in there. They were 7 foot by 7 foot. You couldn't lay it back. You sit up, they come in, and they're so it's like a machine.
Interesting.
People value the fact that you go in, you get it done, and you go home, and they don't care that they see other people. It's just, right. I'd be talking to you with holes all over my face, and we're getting our hyperbaric, and I wouldn't even know who you were. So like, it's just a whole different concept, and I'm sure it's coming here. I have a question for you from Amber. Okay. And it's, you ready for this? So the past weekend, she completed a training with Dr. Karimi, during which he demonstrated his technique of placing Easy Gel deeply on bone for all injection sites. And she wants to know, in your professional opinion, moved up, on his approach, do you agree with purely periosteal plane? We're talking about the gel, or are there specific areas where you would recommend different depth for easy gel?
Sure, absolutely. I think under eye, absolutely. You have to go deep. Absolutely. In the temple area, I typically go deep. I think down in like the nasolabial folds, you can go more subdermal, also in the chin shadow as well, preauricular, because there isn't like any like bone to actually adhere to. But if you're doing easy gel, definitely down the periosteum, absolutely is key. It really just all really depends on the placement of that as far as like where you're injecting it. But I've found really good results in both planes, but you just have to be really intentional. I would not go superficial though in the under eye area using easy gel. That's absolutely a deep injection for me.
Yeah. And I'd say on the temples, you're going to have skin,
Yeah.
you're going to have subcutaneous fat. And the first layer, you're going to have your superficial temporal fascia, right? So with the temple, I go on bone with Sculptra, but I go on the temple with gel. You pop through and you'll feel a little pop with the cannula into the space between the superficial and the deep temporalis fascia. You can look up, just go look up your anatomy slide. So you're in between. I inject it in between those planes, but that's the only product that I don't put on the bone in the temple. If I'm using PMMA, Belafil or Sculptra, I'm on the bone, but the gel I use in between. And
Yeah.
I've seen Dr. Creamy do that too, and he may be going on the bone now with his gel if that's what he did. But he and I were in Medellin, we were in Colombia, and we were doing it in between those temporalis layers. So I know he likes that as well, or at least traditionally had.
I agree. And if the cannula, there's sometimes in the temple area, it's hard to get to that space. So it really all depends. So if I'm doing the Sculptra Easy Gel thread combo, it's deep with Sculptra. Then I get into that space with the Easy Gel if I'm able to open up. And that makes it so much easier when I'm going in with the threads to really kind of give it that lifting factor.
And we'll take one last one here. Have you had any issues with lumps forming under the eyes with PRF? If so, would the issues be spin factor or machine? You kind of alluded to it. I'll answer mine and then you go. But it's, yes, the eye is the most delicate area that you inject. It's somewhat of a closed space in that there's not a lot there. You have to go deep with the gel. If you go superficial, you get a lump. Massage it out right away if you get it. It has nothing to do with the spin. And remember, the beautiful thing about the gel, you can make a robust gel by taking the gel and adding a little less liquid PRF to it and keeping the gel more robust. Or you can make a very soft gel if the under eye needs more of a soft product by adding more liquid PRF. So you can fine tune the G prime, so to speak, by adding more or less PRF. But what you got to keep in mind, there's always an if and but if you got to understand the PRF liquid is what has the goodness. So the slow spin, your spin at 1,000, say, RPM, just to make your liquid PRF, that has your exosomes, growth factors, stem cells. The fast albumin spin, albeit the albumin holds for 3 months plus on studies, proven, 3 months plus, they stopped the study at 3 months. But that gel does not have the extent of growth factor stem cells and exosomes. We don't know exactly what the regenerative effect is of the albumin, but most likely it's certainly not what the liquid would be. So you definitely want a certain amount of liquid PRF with your gel. But go ahead.
No, I agree. I also really think that like educating your patients about preparation before the treatment is key. I always put them on your Plasma Glow of those gummies. No, not only are they super delicious, but when I tell you,
Ran out. I was on a webinar and I got such a headache now because we got none to ship out. We ran out, but
really good. It's like
go
candy.
ahead.
It's like candy. I think I'm out too. So, but they're really delicious. And, these are one of these things, even when, when you started or all of us recommending arnica, I'm like, is this just like a placebo effect or does it actually work? So try it out. So if someone's consulting with me, they get a treatment, they're coming back for their easy gel. I recommend using your Plasma Glow gummies, which are delicious, hydrating really good, following the basic protocol before any injection whatsoever, and like eating a clean diet, because we get so excited and we're like, oh wow, look at this plasma. Like we get so excited and they're like, patients like, we don't even know what that means, but it's like clearer, it's more consistent, and almost like doubling the amount of cc's. So on average, it's like maybe around 5 cc's, of plasma after we develop the Easy Gel. We'll get like 8 to 9 typically. And that's really good because that just gives you more opportunity. Same tubes, same amount of volume as far as the blood draw. But I think really letting your patients know that like having like a cleaner diet, hydrating, good, getting on some sort of supplement to prepare the patient, they are set up for success.
Now, are you joining me in Miami, or is it the other way around? I'm actually being invited by you. I don't know.
I don't know. I guess we're just going to be there together for AMD.
Okay. So we are doing that. We are.
Yeah.
So we'll be in Miami, whatever that is, middle of
It's Valentine's Day weekend.
Valentine's Day.
It is. It's Valentine's Day weekend.
Well, we're both fine to go on Valentine's. I didn't know it was Valentine's, but what's that? What is Valentine's Day? What's the date of Valentine's Day?
February 14th.
14th of February.
14th of February. Yeah. So
they're asking when is Miami? It is AMWC, correct?
it is. Is
that nice hotel again? It's a nice hotel down there. It's actually a very nice event, and they got cocktail hours around the pool, and we have actually. There's a lot of like in the evenings, there's a lot of cool stuff to go to and see, but it's a little has an international flair because it's very accessible to the Europeans and the Central Americans. So I find which I like the international flair of some of the conferences, but that's what I liked about it last year. We had a lot of people from Central America and from Europe. And so hearing their ideas was really cool.
Yeah, it's great because the only other AMWC that I've been to is Monaco, obviously. So this is my first time attending Miami AMWC, and I'm excited because I think we're doing a workshop together, presentation. We'll have to ask our bosses what we're doing. So that's going to be really exciting. AmSpa, I believe, as well in Vegas. At the beginning of the first quarter. So it's going to be a lot of this, talk going on and other resources that we will be able to provide for you, all of us.
I'm going to get my game on. I'm going to maybe do a little more on the priming, and I'll do a little section on those lectures and talk a little bit about the priming with PRF too for the threads. And so we'll have a lot to share there. Please share the link for Miami. We'll be at AMWC Miami. I barely even know how to get there, when we even go. So I'm asking the running guy. I go where they tell me when. but we'll be there, and we'll be at AMSWA's usually in Vegas, and we're going to have workshops on it. So we love to see you guys there. And Amy, thank you for joining me tonight. Always appreciate it.
I appreciate you too, and thank you so much. And super exciting. I think 2026 is going to be amazing, and let's baby glow.
Let's baby glow. Okay. Thank you, everyone. Thanks for joining us. And we'll see you in Miami or Vegas, whichever one you choose.
Sounds good. Thank you so much.
Cheers.